So today I'm here with Dr. Shannon Goecke-Watson to have a discussion about domestic violence and her work around this topic in honor of October, which is Domestic Violence Awareness Month. So Shannon, if you would just please introduce yourself.
I own my own practice in Eagan, Minnesota, SGW Psychological Services, LLC. I exclusively work with survivors of sexual and domestic violence. At my practice, I do both individual and group psychotherapy. In addition to that, I do a lot of different community trainings related to domestic violence. I've worked with folks, I've worked with lawyers, I've worked with doctors, I've worked with court mediators, educating folks about domestic violence. In addition, I'm also an adjunct instructor for People Incorporated Training Institute, which I really enjoy. In addition to teaching classes about domestic violence through there, I also teach classes on stages of change and psychotic disorders.
Awesome. Thank you for giving us your background.
Yes.
We are, like I said, going to have a discussion about this topic to hopefully inform viewers of this video about domestic violence, what it is, and the types of support that are out there. So can we just start on the basic level, Shannon, with what is domestic violence?
Sure. So I define domestic violence as repeated boundary violations within the home for the purposes of taking somebody's power and control. Most often, when people think about domestic violence, they usually think of intimate partner violence or IPV. But the reality is, domestic violence can also be family members. So it could be parent to child to parent, niece to aunt, etc. It doesn't just have to be intimate partners. Domestic violence spans a whole big range of different behaviors. So most people tend to think of domestic violence as physical abuse, and that is certainly one component of domestic violence. There are many, many more. We see financial abuse, we see legal system abuse, we see religious abuse, we see psychological abuse, we see emotional abuse, and many other forms. The reality is all of these different forms fall onto a spectrum of overt to covert behaviors. Most of us, again, tend to think of the really overt behaviors, so something like punching a partner or something of that nature. But the reality is the behaviors can also be very covert. It could be regularly invalidating your partner to the point where they're questioning if their own experience is accurate or not. It could be not consulting them when you're making big purchases for the household, or simply denying that you engaged in behaviors that you did. There really is such a big spectrum of behaviors that are going to fall within that domestic violence or DV umbrella.
Yeah, thank you so much for that. Can you talk more about your background with supporting individuals experiencing domestic violence?
Sure. So folks that get into volunteer work often start by doing a mandatory 40-hour sexual assault training course. I did mine, goodness, I think it was back in 2007, so it's been quite a while. I took it through the Egan Lewis House in Dakota County. I loved the work I loved what I found out that I was able to do so much that I started regularly volunteering. I was both a shelter staff and a volunteer for 7 years at the shelter there. Um, I led support groups for both teens and adults for both sexual and domestic violence. So I was leading 4 separate support groups through there. And then I also became a court advocate. So I was going to court with individuals who were doing things like filing for protection orders or dealing with criminal sexual assault cases or criminal domestic violence cases. I really loved the work so much that I wanted to figure out how I could do more of it. So I had the decision of, did I want to go be a lawyer to fight it in the courtroom, or did I want to go to be a psychologist to fight the mental health after effects? Inevitably, I decided to go back to get both my master's and doctorate to be able to treat the mental health after effects. So all of my training was really tailored to being able to work with sexual and domestic violence survivors. So I trained in a number of different agencies. My dissertation was involved in the treatment of domestic violence. I interviewed women to find out about the intersection between domestic violence and work, which is a really important topic. So that's how I really got into it. I love what I do. I'm really fortunate and feel very fortunate to get to do what I do every day.
Awesome. Thank you so much. Speaking of the different trainings that you offer at different agencies, obviously you offer some trainings here at the Training Institute at People
Yeah,
Incorporated. So can you talk about the trainings that you're going to be offering with us this October?
sure. So the first training that's going to be offered is on Monday, October 7th. It's a 2-hour training. And this particular training is really for anybody who wants to learn more about domestic violence. You don't necessarily need to be a treating provider or anything of that nature. Really, it's open to anybody who just really wants to better understand. So within that training, we're going to talk a lot more about what constitutes domestic violence and about that spectrum I previously mentioned. We're going to be able to learn how to better identify it. We're also going to understand and learn how domestic violence happens. I hear a lot of people share with me things like, as a card carrying feminist, and I don't know how I ended up in this situation and things like that. And the reality is, DV is very subtle. And so we talk about kind of how it's like getting sucked into a tornado and how we end up in those situations. We also talk about different factors involved, things like about how COVID increased rates of domestic violence and things of that nature. In addition, we're going to highlight neurological consequences of experiencing domestic violence. I'm a massive brain nerd, so I think it's important that we talk about the brain. It's what we're treating, or as a psychologist, it's what I treat. So it's important to me for us to be talking about neurology in the brain. And the reality is there are numerous after effects of experiencing domestic violence. We'll also talk about other after effects, like the social after effects and things of that nature. And then we're also going to be talking about specific strategies really anybody can implement when they're working or when they're involved with somebody who's experienced domestic violence. So it'll be some things I'm going to do to take care of me and things I can do to help whoever I happen to be talking to. Again, these are general guidelines that can be used if you have a friend or a family member who ends up endorsing to you that they've experienced domestic violence. So it's a really great training. It's been offered a few times here at the Training Institute, and we've gotten really great feedback on it. The second training that we're going to do is on Monday, October 21st, and that one is also a 2-hour training. I should mention the first training is going to happen via Zoom. The second training is actually an in-person training at the Training Institute space. I'm really excited. It'll be one of the first in person that I've got to hold in a while. So I'm looking forward to that. The second training on October 21st is specific for individuals who do behavioral health treatments with individuals who've experienced domestic violence. So I'm co-presenting with a lawyer, Heather Turner Morgan, who works a lot in her practice with survivors of domestic violence in the family court system. So I'm really excited to be able to co-present with Heather. So again, this particular training is really geared towards therapists and psychologists to really be able to understand the intersection between domestic violence therapy and the courts. So that's where that one comes in. So we're going to be doing things like comparing and contrasting how therapy looks or how domestic violence looks within a therapeutic setting versus within the legal setting. The reality is the legal statutes of domestic violence look very different than trauma statutes from a mental, or not statutes, but trauma guidelines. So we're going to be comparing and contrasting those. We're also going to be talking about different protection orders that are available for people to apply for if they need to be able to have protection against this intimate partner or a family member. We're going to be talking about ways that therapists can help their clients as they're navigating through the court system. The reality is the court system is very confusing. And so we're going to be able to give specific strategies that therapists and psychologists can use to help people that are navigating that system. We're also going to be talking a lot. The reality is a lot of mental health providers feel a little bit of fear and anxiety when they become subpoenaed, which is a real thing and can absolutely happen if we're working with survivors of domestic violence. So we're going to be talking about what to do if you're subpoenaed. And I think that that's a really important thing for us to be talking about. So that's really the purpose of the two trainings. I'm really excited for them. I'm really honored that Heather Turner Morgan has agreed to join me to be a part of that. So I'm looking forward to it, and I hope to see as many people in those trainings as possible.
Yeah, me too. Those sound like really valuable offerings.
Yeah.
I'm excited that you can offer those. Um, sticking with these trainings, what's the goal of trainings like these ones that you were just explaining?
Mhm. So there's a couple of different goals for the purposes of these trainings. One is to really build awareness of domestic violence. Unfortunately, domestic violence is more common than we like to believe. I've seen numbers anywhere from a quarter to a third of women will experience physical assault. And anywhere between 1 out of 7 men to 1 out of 4 men will also experience physical assault perpetrated by a domestic partner, which is very concerning. So this is an issue that is out there, it's real, it's prevalent. And so one of the big purposes of these trainings is to be able to really build awareness and to help people to understand that domestic violence is an issue. It continues to be an issue. Another reason that we're trying to do it is we want to better educate those who do work with survivors or those who come in contact with survivors of domestic violence. As I said, the two different trainings really have two different purposes. The first training is really good for anybody who may even have a family member involved in experiencing DV. The second one is specifically tailored to psychologists and therapists. And so, what we really want to do is we want to educate anybody who comes in contact with survivors to be able to help the survivor in the best way that they can. And then, really, the third goal is that we want to do what we can to prevent harm. We want to be able to educate people so that they don't get sucked deeper and deeper into that tornado, which I previously had mentioned. And so the best intervention in the world is prevention. So if we can help people to become aware of what they're experiencing early and earlier, we can prevent more harm from being done. So that's really the purposes of these. And the purpose of doing this and the purpose of offering these trainings is really to gain awareness and help people to understand that there are ways that this can be handled.
Yeah. Why is Domestic Violence Awareness Month important to recognize?
It's such a great question, and there are so many answers. A big part of that is going to come to exactly what I just mentioned, which is a big part of it is to bring attention to an important issue that does continue to be extremely prevalent. The reality is, domestic violence often will become um, there'll be awareness of it when somebody like a celebrity uh, comes out and says that they've experienced it, or somebody, a big celebrity, is arrested for perpetrating it or something of that nature. So then we hear a whole lot of it, and we hear all sorts of resources, all this stuff comes out, but then it kind of goes quiet again. So the purpose of October is to really have an entire month where we get to talk about this subject and make it big and make it well known and make it for the average individual to be able to hear about it. It's also important that October comes because it's a time for us to provide accurate information about experiencing domestic violence. With social media platforms right now, such as TikTok or Instagram, there's a lot of really great information that comes out on those platforms, but there's also some information that may not be the most accurate. And so October is a time where those of us that come from a background of research and things of that nature and resource can really share that and get that accurate information into the public hands so that people can use it. They can figure out what is true. They can figure out fact and fiction, things of that nature. So the way I look at it, if Domestic Violence Awareness Month can help even one person learn more about domestic violence, it's a really great month, and we've done something really, really valuable. And so I hope that, ideally, I wish it was more than just 1 month. I would love to see it be more, but we're going to give everything that we can in October. I do want to mention as well, February is Teen Dating Domestic Violence Month. So that's important to be aware of. I believe the color for that, the awareness color for that is orange. The awareness color for Domestic Violence Awareness Month in October is purple. I've got my purple on today. Um, and then there is also Sexual Violence Awareness Month, which is April, and the color for that is teal. Now, I do want to mention one specific day in October, and that is Thursday, October 17th. And Thursday, October 17th is National Wear Purple Day. So it's a day in which we urge you, and I please ask of you to consider wearing your purple that day. It's an important day. It shows that we are both raising awareness, but it's also a day that we get to show survivors that we support them. So I ask that you all please consider wearing your purple on Thursday, October 17th.
Awesome. Thank you for pointing that out.
Yeah.
Now, for the last question today, I wanted to ask you from your personal experience, what
Mhm.
message you would send out to survivors of domestic violence?
There are so many I would love to be able to share, but I really want to synthesize three important ones here. The first one is you are not alone. The reality is somewhere between 25 to 33%, if not higher, that's reported. We know a lot of domestic violence goes unreported, but somewhere between 25 to 33%, if not higher, of women will experience physical assault perpetrated by a romantic partner. And somewhere between 1 out of 4 and 1 out of 7 men will also experience physical assault perpetrated by a romantic partner. Those numbers are high. And so I just encourage you all to know you are not alone. If this has been your experience, you are not alone. The second thing that I really want people to be aware of is that people need to make the decisions that are best and right for them. So often, when a survivor discloses they're experiencing domestic violence, one of the first questions they hear from family and friends is, "Why don't you just leave, or let's get you out of there?" And the reality is, domestic violence is so much more complicated than that. There are many factors beyond simply love for why somebody ends up staying in an abusive relationship. And so, by saying we need to get you out of there, why don't you just leave, we're negating all of those other factors, such as fear, uh, financial issues, disability status, things of that nature. And so, if you are experiencing domestic violence, I just urge you to please know that you get to make the decision that is best and right for you when it is best and right for you. And then the third thing I want people to know who've experienced it is that help is available. There are a lot of different resources out there to be able to help. Here in Minnesota, we have what's called Day One, which is a shelter line across the state to be able to get people connected into shelter services. So they're kind of like the dispatch for shelter services. They do some really, really great work. So if you are in a situation where you are not currently feeling safe, help is available in that way. I also hold up as a mental health provider myself that help is available from this perspective too. There are numerous people who are well trained in treating after effects of domestic violence. And so the reality is you don't have to experience the symptoms of trauma for the rest of your life. Treatment is out there. I regularly say to my own clients that it's important to know that trauma is treatable. And so I want to echo that out there now to survivors. If it feels like it's going to always feel this way, that doesn't have to be true. Mental health resources are out there. And then I would be remiss if I didn't give out a quick little plug for all of the agencies around that also do really great work. Your local domestic violence shelter, again, those can be contacted through Day One, as I previously mentioned. Um, if you were struggling with the finances after experiencing domestic violence, there's the Minnesota Crime Victims Reparations Board that's out there to be able to get services like therapy covered. So there's really a great plethora of resources that are out there. So those three to me are the really important. You know, you're not alone. You need to make the decision that's best and right for you, and help is available.
Thank you so much, Shannon. That
Yeah.
was really valuable insight, and we appreciate you sharing your expertise with us today. So thank you
Thank
so
you
much for
so
being
much.
here.
I am so grateful for this. Thank you so much for this opportunity to be able to share and to talk about this subject that is really important.